Jeffrey Seward. I'm a nurse practitioner, legal nurse consultant, owner at Med for Law. We're going to talk about 5 common sense ways to avoid being sued in the emergency room. The emergency room is fast-paced, dynamic, and you're managing high acuity patients daily. So I'm going to give you a few examples of some ways to provide the best care and to protect you from being sued. Number 1, assess all labs and radiology reports before the patient is discharged. And what I mean by that is, say you order a urine pregnancy test on a patient. The patient is unable to go to the bathroom and you get busy and discharge that patient home. You find out those results come back as positive for the patient being pregnant. That would change your outcome pretty fast. So I just want you to understand, to any lab or any tests or anything that you order, just make sure you are looking at all those results before that patient is discharged home. Number 2, always inform the patient of any incidental finding. And what I mean by that is, say you order a chest x-ray, the radiologist reads that out as a pulmonary nodule. That is something that probably has nothing to do why the patient is in the emergency room that day, but you still are responsible for those results and still need to inform the patient of the pulmonary nodule. You need to document that you had that conversation, and then you need to document that you inform the patient to have close follow-up with their primary care provider. To close the loop on that, you could also send the primary care provider an inbox message with the incidental findings. Number 3 would be to inform and discuss any procedure in detail with the patient. Any procedure that you're going to perform on the patient, you need to go through the risks and benefits in detail with the patient, and then also have a signed consent form before the procedure would begin. You need to answer any questions that patient would have on that procedure. Number 4, to know your audience. Patients come from all walks of life with various levels of education. Just make sure the patient has thorough understanding of what you're speaking about, you're communicating effectively, and they can take notes, you can take notes, ask questions, you can ask family members if they have any questions, but just make sure everybody's on the same page on any procedure, any test, anything that's going to be performed in the emergency room. And number 5, documentation is key. Document, document, document. If it isn't written down, then did it really happen? So anything we talked about already, and then also any testing that's performed, any communications, any assessments, any findings, any procedures that are completed, any consultants that you talk to, just make sure all that is documented in the chart. These are 5 very basic but common sense actions that can make a big difference in your practice, providing the best patient outcomes.